Hello everyone, welcome to my section of the Group 4 Cardiac Project. Our group is focusing on heart failure. To be more specific, left-sided heart failure. I will be discussing two of the nursing concerns exhibited by our patient Fred, an elderly man who, due to his left-sided heart failure, is no longer able to enjoy his favorite hobby of blowing up balloons. The first nursing concern is impaired gas exchange. The second nursing concern is excess fluid volume. So let's start with impaired gas exchange. This occurs in left-sided heart failure because the heart is not pumping enough blood out to the rest of the body. Specifically, the left ventricle is filling up and not shooting everything inside of it out. It's only working partially. So that means that there's an excess of blood building up. Well, that blood backfills into the lungs. When that occurs, it's not good. Presentations of this are dyspnea, labored breathing, slow capillary refill, cyanosis, low oxygen saturation. These can all be seen and diagnosed via auscultation of congested lungs, abnormal heart sounds. You can have a BNP blood test that, if it's over 100, is cause for an alarm, because that means that there's too many cells, heart cells, that are dying, and that can show up. That's a good test to get an idea on that. You can see with chest x-rays, you can see just visually an ineffective breathing pattern if somebody's really struggling. If they have an increased respiratory rate, like up there, like 30 or 40 respirations a minute, that can be a bad sign. That means they're not getting enough oxygenation and they're fighting the fluid in their lungs, which this will build up to somebody having anxiety and also being stressed out about not being able to breathe. Justifiably so, I think. So treatment for this starts off with the administration of oxygen via nasal cannula. 2 liters a minute. We want to get that oxygen saturation above 94% if possible. We want to elevate the head of the bed to improve lung expansion and allow for easy breathing, nice and easy. We're going to administer beta blocker medications such as Lopressor to relax the heart and increase efficiency. Our goals are to improve oxygenation and the patient's ability to breathe while reducing stress and anxiety. To evaluate this, we're going to check his oxygen saturation and ensure that it's above 94%. We're going to try and decrease the respiratory rate to within normal limits. And we're going to get the patient to verbalize that they no longer have anxiety or stress over quality of breathing. So hopefully they can get to there. And then we're going to teach the patient deep breathing techniques, relaxation, and stress management techniques. Because them hyperventilating, doing the is not working out for them. So they need to calm down, take a deep breath, and out. And that's what we're looking for in impaired gas exchange. For excess fluid volume, same thing. Fluid is built up, obviously, into the lungs. Same reason we're getting ineffective gas exchange. So presentations are dyspnea, crackles, shortness of breath, cyanosis. The crackles you can hear when you auscultate in the lungs. Cyanosis can see, shortness of breath you can see, dyspnea can be seen, heard. You can tell. Diagnosis for this is CBC low hematocrit test. If that shows up, then that means that's indicating that there is fluid in the lungs. So the treatment for this is to put somebody on a diuretic. So we're going to give Fred something like Lasix, and we're going to limit his fluid intake a little bit. And this is going to help release some of that fluid that his body has been retaining. So he's no longer storing it, which should hopefully help clear out his lungs and allow him to breathe easier and better. So that's our goal, is to reduce fluid retention, and our evaluation is to get the hematocrit levels to return back to normal. So to teach our patient, Fred, how to live healthier and be better, we're going to instruct him to change his diet up a little bit. Start going to lower sodium, and to reduce his fluid retention and the workload of the heart. We're going to limit his fluid intake, and we're definitely going to limit his alcohol intake. And I think with those, we're going to have him on the path to health in no time. Thank you.